say like to their provider, I don't want to tear. Please help me do anything. And the provider says right back to her, honey, everyone tears. Now just focus and push. And it's like, zing for me. Like you cannot just say that. Not everyone tears. Like I didn't tear.
Hey everybody, welcome back to my channel. If you happen to be new here, just curious about doulas and who to have on your birth team, welcome. My name is Dr. Nicole. I am not only a pelvic floor physical therapist, I also have 2 little boys of my own, 1 hospital birth, 1 home birth, and I am planning my 3rd birth coming up in June, which I'm really hoping is going to be a home birth. And so I myself have wrestled with this question of who can I afford to have in my birth space with me. I had some questions about doulas because sometimes it's confusing to know what is the difference between a doula and a midwife. And so as I wrestled with this question and putting together my birth team, I went to my friend Mandi, who's also a fellow birth worker. She is actually a DONA certified doula. She is the owner of a local company here in West Michigan called Great Lakes Doulas. And I asked her some of my doula, midwife, do you need a doula? What does a doula do at your birth questions? And without further ado, I am so excited to announce that she is here with me on my channel today. So welcome, Mandi.
Thank you very much. I'm very happy to be here with Nicole.
So just like me, I think a lot of moms watching this are really wrestling with that question. What is the difference between a doula and a midwife? Do I really need both at my birth? And so in my experience with doulas and midwives, I've had one of each. I feel like the biggest difference to me was that the midwife was really there to keep me and my baby alive and well and healthy. And the doula was really there to support me during the birthing process and also to support my support people. So I'm sure I'm simplifying this a little bit. Is that correct? And what else would you add to that, Mandi?
Well, yes, you're asking a big question. What is a doula? I will start off with saying the role of the doula is not just about mom. I think a lot of misinterpretations happen around, most of the time it's moms that want the doula and it's the dad that usually is like, I don't know, is it really worth it? Is it really not? She thinks, I really want someone there to know what to do and like how to help me. And he thinks, is it really worth that investment? When there's any discrepancies in why we should have a doula and mom and dad are maybe even a little bit different in their views, I like to start off with letting everyone know that doulas are for everybody. Doulas are for the mom, we're for the dad, we're for the baby, we're even there for siblings if it's a home birth and there's siblings there, a grandma, the midwife, whoever it is, like we're there to serve. Doula means slave or servant in Greek. And so when it comes to birth setting or even postpartum setting, doulas are really just that. We're there to serve and we're there to do really anything that's necessary. Aside from caring for the whole family, the role of the doula, I like to break it down into 4 different parts. There's physical support, there's emotional support, informational support, and advocacy. Physical support for a doula is what a lot of people probably imagine when they picture what is a doula. We're reminding you to go to the bathroom. We're getting you drinks of water, doing the hip squeezes and the position changes. And we're doing a lot of dirty work, maybe changing bed sheets out if you're having a home birth. I was at a home birth once where I was barreling water out of the birth tub because it got too full and we needed to like hurry and get water out for the delivery of the babies. We're there also for the emotional support of everyone there. So, I mean, we can imagine all the emotional things that mom is going through, but like, let's talk about dad or partner. He's going through a lot of emotional things, like watching the person he loves most in a really difficult place. Maybe he's not even comfortable or used to seeing her struggle or work really hard for her goals and vocalizing in ways that he hasn't heard her vocalize, etc. So we're there to mentor him and let him know that like what's happening to his partner, to his wife is normal and it's okay, and giving him space to process maybe hard things that he had to see. And then we're there for the emotional support, of course, of the birthing person, the mom. There's not a lot of people that are focused in the birth room on how her experience is perceived. Everyone in the room might have thought, oh, she had this amazing birth. I wish I had something like that. And lo and behold, mom is feeling no one was actually there to like care about me or like my story. It was all about the baby or like setting up the pool and I was laboring alone most of the time or something like that. So I do feel like that is a huge separation between a provider and a doula. The doula cares a lot about your emotional state. And I would take it one step further and say that doulas care a lot about your hormonal state in labor. So we're caring about your oxytocin, we're caring about your adrenaline, we're caring about if you're feeling safe and secure and loved and supported and like in a place that you can relax and actually release your baby into this world. If everyone's talking loud and like doing all the things that are like really disturbing and disrupting to you, and like the song that you had playing on Pandora goes to commercial or something, you know, like we are on it like Pop-Tart, because we are so like wanting to keep you in that labor flow state, because we know how important that is to keep labor flowing well and to keep you focused and doing a job well done. Informational support. Every single birth has a fork in the road that you come to at every birth I've ever been to, there's a fork in the road, right? I have a choice between a hip squeeze or getting into the tub. Which one should I do? Okay, there's going to be benefits and risks to anything that you do. Doulas are there to say really quick things like, this is a couple of things you need to know about, you know, an episiotomy, for instance, or, you know, assisted deliveries or coached pushing or anything like that. We're also there in the long run. We work with you in your labor. We also work with you during pregnancy to answer and prep you for as many questions that you can throw at us. So we're kind of like the walking birth manuals a little bit. And we're really excited to be able to let you have that informed decision and the choice that comes with knowing all the story, which is so rarely the case, unfortunately, in our world. Yeah. And then finally, we get into advocacy, and that one gets a little sticky. I feel like a lot of times people interview me and they're like, listen, I had a really hard birth with my first, and things happened to me, and they kind of, the hospital staff made me feel this way, and I felt like I had to choose this. So I really want to have a doula so that when I say, you know, I don't want epidural, and somebody comes in and says, you know, we're going to do epidural, that you can tell them, no, doulas cannot make decisions for you, and we cannot speak to the staff on your behalf. It's outside of our scope. But when it comes to advocacy, we are 100% ready to speak next to you and with you. So I like to say, like, as long as you say it to the staff on your own behalf and with your own lips or with a birth plan, then I have a lot of ground to be able to reinforce what you've said. Doulas give you the words to say a lot of times if you're intimidated with how things are going, or you don't know exactly how to say it. We give you choices and we let you know your options so that you can advocate for yourself and like have the power to have that empowered birth that a lot of people talk about.
I just want to interrupt you for 1 second, because this is something I definitely feel like I experienced with my first birth. I really went into it feeling very prepared and educated, like knowing all of the things. But then in the heat of the moment, one, you kind of forget things a little bit that were important to you. And two, you just are so worried or scared, unsure about the situation, that I feel like you're easily talked into things. So for me, it was like, okay, baby's heart rate is dropping, we're going to do an episiotomy. And in my, like, looking back, I was like, well, why didn't we try a position change or something first? And so I just love that about what you guys do, kind of reminding us or helping us have the courage to say, like, I would really like to try this and not just feel intimidated. Like, if we don't do it this way, like, everyone's going to die, you know?
Yeah, right. Yeah. And that's, I mean, like, so, but the hospital staff, like I say this a lot too, they're not evil. Like, they're not bad people who want to like ruin your body and like ruin this like amazing birth story that you have. I would say that they're extremely empathetic people who want to serve you and they want to help you, but they only have these tools in this basket: episiotomy, forceps, C-section, epidural, Pitocin, you know, like they only know the tools that they have. So doulas come in with a whole different basket. And I'm not saying like these tools are much better than these tools. I'm saying, hey, like before we go adding a little bit more force or like a little bit more risk in terms of recovery, let's try these tools first, because they're gentler, because they're going to be a little bit more easy for baby to handle, and it'll make your birth hopefully more sustainable for you instead of just jumping straight to that basket.
Yeah.
Is there times that my basket doesn't work out all the way? Yes. Is there times that we needed Pitocin? Yes. So it's like, thank goodness for those tools, but let's not just jump right into that basket right off the bat, right?
Yeah.
Few other points that I wanted to say. One that I think is very important is the fact that doulas do not work for the hospital or for the provider. So there's a lot of things that can happen between the interactions between provider and doula. And I think it's really fun and really cool to say, like, we don't have to tiptoe around our interactions with the provider because we're not working for them. They don't have much like leverage to hush us up, I guess. Does that say that doulas are naughty in the birth room and we're like always looking for a fight? No, but it is something really important to note that like when you hire a doula, she is there for you and for like all of the things that you want. And there is no other storyline that she's going to play into for anybody else that's in the room.
So if you had to sum it up and say, like, of all those things, what is like the number one reason if someone was like, why should I hire a doula? And you had, 1 minute to answer them. What is the number one reason someone should hire a doula?
It's different for everybody. A couple of reasons that maybe a lot of people would like to hire a doula is the feelings that they get from why they wanted the doula in the first place. So the feeling of being safe, knowing that there's empathy, knowing that there's direction in their labor or support on like a trailblazing kind of mindset. They want to know that they are protected and that, there's a lot of like peace of mind around having the doula. A lot of my clients, they just soothe so differently just because I'm there. They, especially at a home birth, like to know, the doula comes in before the midwife, maybe for a couple hours. And if you haven't experienced labor even for the first time, or maybe your labor is different the second time or the third time, and you think like, am I in danger? And just the pure fact that like the doula who's with you is in a calm state and is very peaceful, you can like really relay your emotions with her and know like, okay, she's not freaking out. So I don't really need to freak out. Like she doesn't think it's time to move to the hospital. So I know that I'm safe here because she is the expert. She is the navigator. She knows these things. It's not her first rodeo.
Is there any reason why you think a doula isn't a good choice for a person? Is there any reason someone shouldn't hire a doula?
I am a doula, of course, and I have had a doula at every single one of my labors. I do think that doulas are beneficial to everyone. So that's my initial thought is I have no idea why they wouldn't want to do it. But to relay back to things that, I hear often is like, I don't have the money for it. I don't think that we can afford a doula. And that unfortunately is just the case. Another one would be they feel like they can very easily and very confidently trust the support people that they have already around them. I've had people connecting with me for prenatal stuff and education. And then they say at the end of the day, like, I want my sister there and I want my mom there. And I don't feel like we need to have a third support person. And it's like, okay, like that's totally okay. And then finally, another misconception and also another really huge reason why people choose maybe they don't need a doula is because they anticipate that because they chose a midwife, that they won't need a doula because the midwife will perform the same duties as a midwife and a doula collectively. We hear this a lot from like the home birthing community. We think like, she knows a lot about baby positioning and this midwife knows a lot about, how to show my husband something real quickly, but it's not always the case. I think there's a few rare midwives that can act more empathetic than others, but it's not the bottom line job for them. Their bottom line job is get baby out and make sure everyone stays safe. If they're going to be pleasant and friendly and supportive and helpful in hip squeezes and all of those things while they're at it, that's great. Is it rare? Yeah, it really is. Even in the hospital, even in home births.
Yeah, I think that sometimes there's just too much to do too. Like even if the midwife knows that stuff, would like to do that, there's a lot of things that are going on during birth. What about the person that has a planned C-section? What about for them? Is there any reason for them to hire a doula?
Yeah, like even in a C-section where there is not as much physical support, informational support, advocacy, the emotional load goes up such skyrocketing amounts, right? Like, okay, we all know what C-section is. We know what's going to happen to our bodies somewhat, to the point where it can like really stir up a lot of anxiety there. So the celebration that can be a part of it, the talking through of like what's going on, what to expect next, all really good. The emotional support for dad, for the partner, to let him know like she is going to be okay and you are too. I've been in C-sections where the baby is born and the mom bursts out in tears because she's so happy and everyone sings happy birthday. And it's like, I get to be part of this like amazing celebration. And I've been part of C-sections that are very scary, honestly, and are really hard for the husband or the partner to like digest. Times where the husband and the baby and the mom had to be separated. And I got to be able to be in the OR holding this newborn while the partner could support his wife. And I think like in times like that, like the baby would be at the warmer or with a nurse that maybe you just met or something like that.
I think you're exactly right. There's less physical need, but a ton more emotional needs, especially if it's your first one and you're not sure what to expect. Yeah, lots of emotions. It's important to also highlight that not all doulas are created equal. There is a certification process to being a doula, but many of you, I know personally that Mandi specifically has done additional training. She's done spinning babies, and you're right now in the midst of learning about protecting the pelvic floor during the birthing process, and that's not something that all doulas are required to do. Maybe there's a doula that specializes in VBACs or what have you. So I think the main thing here is that when we interview, when we pick a doula, it's really important to ask the right questions. I know when we had our first interview with our doulas, we were like, okay, are you gonna like help us advocate for our birth plan in the hospital? And then after that question was answered, we were like, you seem like a nice person. Like, it was just hard to know what other questions to ask. So if someone's watching this thinking like, maybe I do want to hire a doula, what are 3 questions that you would suggest that they might ask their doula during that interview to make sure they get someone that's a good fit for them?
So when it comes to hiring a doula, I feel like it's really essential to go into the meeting knowing generally what you're hoping for with your birth. Yes, there are doulas that are not created equal, but I wouldn't say that it's because some are good and some are bad. I would say like their training is different, or like their experience is higher or lower. There's additional training. There's a lot of like passion that goes behind what we do in the birth room. So there's like people who love working with single moms. There's people that like working with teen moms. There's people that love the VBAC. They like first time moms, like whatever it is that really gels in our heart is really like where we find our passion. So for me, my passions are in baby positioning and body mechanics. And I just thrive thinking about how we can put our bodies like in cool positions and like make birth easier. It's like blows my mind why not everyone loves that. The way that, you know, you love the pelvic floor. I'm like, that's cool. Like, I would say once you know what you're wanting from your doula, make sure that you ask good questions about if she has it. I would ask hard questions like, what's your birth philosophy? You know, how do you view birth in general? And you might hear some like sugar-coated answers like, I just think it's beautiful and I want to be there for you and I'm good at supporting you. But then you might get people that are like, listen, birth is my life. And I feel like there's all these theories around it. And there's like important things that you need to know about this, and this. And you can know like, that's the person that is so inspired about the birth room that like will truly take this deeper with me if I need it to. And I think that shows a lot. So it's not necessarily what she says, but like her attitude about how she says it and how passionate she is, beyond what her contract says, beyond what her experience says, beyond all of the like good things that you could put in your paperwork. If you don't have a connection with that person, even if they were amazing, don't hire them. If you have somebody in front of you who's like honestly telling you like, I really love birth and this is my first time, but you feel like she could be your best friend over all the interviews that you've done, that's the person you need to go to. Why? Because birth is the most vulnerable, most difficult experience of your life Maybe you do it 2, 3, 4 times. Those are all the most amazing experiences of your life. You need to have people around you that you can fully trust, fully release in front of, and fully know that like there is zero judgment and that you can perform like what your body needs to do and be able to do it well without thinking, what is she thinking? Or what is she doing?
I've never heard that said before specifically, but I think that's like so important in a birth space. And something I would add with my own experience was that I really wanted a certain personality type, because I know my personality type, I'm a little bit like strong-willed, and I don't exactly like being told what to do. My husband would probably put it differently than that. But in general, I don't want someone telling me what to do. But I also, that's what I'm paying a doula to do. So I want someone that's a little more like confident, and I don't want a timid personality. And I know for some people, like that very calm, like, that personality would be great for them. But for me, I want someone that's like a little bit more confident, a little bit more outspoken, you know, not rude, of course, but just like that I feel like is not going to be afraid of me in the birth room or afraid of any of the other birth workers. And so you really, I think you nailed it when you said you need to know what your birth plan is, and then that will help you guide what kind of doula you're looking for. What are the 5 things, I'm sure there are many things, but what are 5 of the things that you specifically would offer a mom in her birth space?
Yeah. So once again, my complicated answer is not going to sufficiently like appease you and your hard questions. 5 things. Like, I'm the servant. I do everything. I'm going to be doing tons of pain and coping skills and counter pressure and helping you get through one more contraction, just one more, right? And you can do all those things. The generic stuff, right? Like the suggestions for position changes and making sure that you're encouraged and making sure that you know like the process that's unfolding for you, and that you have heads up and that your partner has a heads up, like transition is close. You're going to feel like this. This is what you'll feel, you know, the problem solving and offering support, like with just communication with your provider and your husband or whoever. But really like the biggest thing that you do as a doula is the consistent support. Girl, you have better believe that I am going to be checking the position of your baby like well before labor starts. And then while labor is progressing, I am like just so tuned in to where your baby is in the pelvis, so that when we're applying what I know to the positions I give you, I'm not telling you to do something that would be counteractive to where your baby is and how we're going to help get your baby out. So here's a fun little thing I like to teach. I want everyone watching to sit on their hands.
Right.
You too, Nicole.
All right, I'm ready.
Find your sits bones. And then when you find my hands are underneath of my booty like this, and I feel my sits bones right at the tips of my fingers. Do you feel it?
Yep, I'm there.
Yep. Okay. So I kind of give a wiggle. Your knees are together, your ankles are together. And then what I want you to do is tip your knees out and open your legs up. What are you feeling your sits bones do? It's a little tricky at first.
They're together.
They went totally in and they go down, right? So what is happening is if these are my sits bones in the pelvis, it's going like that. It's closing the amount of space that I have for my baby to come out. So when so many women are giving birth, and the position that we see in Hollywood movies, or even like hear from people giving birth, like, what are they doing? They're in that deep lithotomy position on their back, legs pulled up wide, right? We're closing the bottom of our pelvis, and it's harder for us to birth our babies. Yeah. Why? So here's the other thing. I want you to go back, find your sits bones again. Find it right here on the tips of your fingers. Now what I want you to do is take your femur bone, so right on top of your thighs, and I want you to try to get your femurs to kiss. Yep. So you might have to open your ankles. You might have to go a little bit pigeon-toed, but what are you feeling in your sits bones?
And they're going out.
Yeah, they go out and they go up a little bit. And what actually you're feeling is we're opening the bottom of the pelvis by 30%. 30%. That's huge. Like when you're talking like a baby size, like coming through your pelvis and you're opening it by 30%, that's amazing. That's amazing stuff. So it's just like a very simple, small like example of how we can put our bodies in correct positioning so that birth doesn't feel the worst, right? Like it doesn't have to be a huge struggle if it doesn't have to be. And I also am caring a lot about your pelvic floor. And not every doula will like directly just come out and say that. Like I have been, you know, when the earlier phases of my career, like I was in home births, I was in hospital births, and I saw so many women tear what I felt was like really unnecessarily, or they would say like to their provider, I don't want to tear. Please help me do anything. And the provider says right back to her, honey, everyone tears. Now just focus and push. And it's like, you know, zing for me. Like you cannot just say that. Not everyone tears. Like I didn't tear, and I want to say it every time. I want to be like, I didn't, you know, but you know, that's how it falls out a lot of the times. Like we don't have a lot of good training for our providers, or like developed like practices. It takes 17 years from something to be, you know, made evidence-based and for it to actually play out into practices. Like, so some people think my doctor is going to protect me. My doctor is going to do all these things to like help me, but maybe not. Like it's a really hard thing to swallow, but maybe not. And so I just care so much about the women that I serve and the families that I get to be with. And I am also a postpartum doula. So I follow them from their birth experience into postpartum, and I'm caring for them in their home for like weeks after. And I cannot stand it when I have to watch a mom recover not only from giving birth, but from tearing miserably. And it's just not fair. It's not okay. We shouldn't treat our women like this, because the reality is that there are techniques out there that can help you not tear. There's a lot of things that your provider can do. There's a lot of things that you can do.
I do not think enough people realize that all postpartum recoveries are not created equal. I think there is a lot of misconceptions about like, you have different, like everyone, you know, how long did you push for, or how long was your labor? But I don't think, and I see this a ton as a pelvic floor physical therapist, I don't think a lot of people realize that your recovery is different depending on what happened to your body during the laboring and pushing phase. And so it just makes my heart so happy when there are other workers out there, other birth space people that are advocating for the pelvic floor, because I can definitely testify to the fact personally and with clients that tearing takes a long time to recover. It affects intercourse. It affects your ability to sit, which affects your ability to feed your baby, which affects like your ability to get back to exercise and get back in shape. And like, there's just so many things. So something that I am trained in to do as well is prep people for like birth, so we can, you know, see each other before they have their baby to talk about the best positions to prevent tearing and a lot of the stuff that you just talked about. And I've had clients ask their provider for physical therapy, and then the provider says like, why would you need that before you have your baby? And so there is lots of room for people like me and you to be educating and advocating to not only workers, OBGYNs and midwives, but also to clients themselves to say like, no, there is something they can do and I want that referral. So anyways, rant over. I just think there is tons of room for people that care about the pelvic floor, because all women have one and they all go through a lot during birth. Thank you so much, Mandi, for taking the time to answer all these questions. And I have more questions in my head too, and I'm sure other people watching might have more questions about doulas, or maybe you specifically if they're local. So where can people find you?
You can find me at greatlakesdoulas.com. I mean, it's just pretty simple. You'll see all the things that we offer in Great Lakes Doulas. We have lots of different types of support. And you also see a lot of doulas that I mentor and promote too, because I also have a heart for being loving as a doula. So we have a lot of other doulas that work with us as well. And
well, thank you again, Mandi, for all your time and for sharing your expertise and helping women that are on the fence about doulas. For anyone watching that wants more information about home birth specifically and setting up your home birth space, this video over here is going to be a great place to head next. Thanks so much, everyone, for watching today, and I will see you all in the next video.